Decongestion. This is in chapter 36, mechanism of action. It's going to decrease swelling of blood vessels in the nose and the sinuses. So the whole point is that we're decreasing congestion. So we're shrinking those engorged nasal mucous membranes and we're going to relieve nasal stuffiness. We can give this oral or inhaled. They both have, those are the two routes we can use those for. So the therapeutic effects, decreased nasal and sinus congestion. Indications could be allergies or sinusitis, right? And inflammation of the sinuses, common cold. Precautions, we want to be careful with patients who have hypertension because it does cause narrowing of the blood vessels. And then heart disease and dysrhythmias for the same reason. Contraindications would be uncontrolled hypertension, uh, and then again, possibly heart disease and some dysrhythmias, again, for the same reasons that we talked about in the precautions. Side effects would be nervousness and insomnia, elevated blood pressure and hypertension or palpitations. Important to remember is the nasal route. For nasal route, there's drawing that's going to occur. And what can happen is called rebound vasodilation. So if a patient overuses the medication, they develop a dependence of the inhaled decongestion. And then they'll have what's called that rebound vasodilation. So what happens is they get even more congested than they were when they started, right? They just get this basically acute vasodilation and congestion all over again, probably magnified than what it was when they started, basically. Okay. So what we could recommend is we could recommend an oral route of a decongestant to avoid that rebound congestion, right? So if you have a patient that's taking something inhaled, right, you hear of Afrin, right? Afrin's a trade name for a particular drug, and people use that. They inhale it nasally, and it helps with nasal decongestion, and it's pretty immediate. It's pretty fast, right? So if they overuse that, then they're going to have this rebound vasodilation that occurs as soon as they stop using it. So it's worse than when it started. So for that particular patient, in order to maybe divert from having that rebound vasodilation, they can switch to an oral route, to an oral medication as a decongestant, so they can avoid that rebound congestion. Nursing actions, monitor for therapeutic and side effects, monitor blood pressure and nasal mucosa. Patient education, we need to educate them to the correct use and again to those potential rebound effects. Examples of drug in class. So for oral, we have pseudoephedrine. Okay, it's an adrenergic. It's going to constrict the vessels. Okay, and then inhaled use, that's the prototype for oral. Inhaled or nasal, the prototype you have is oxymetazoline. Oxymetazoline that's your Afrin, right? Trade name is Afrin. That's an adrenergic. Epinephrine and norepinephrine are the neurotransmitters. So it's going to constrict those vessels. And then the other two prototypes you have listed there are mometazone and then phenylephrine or neosynephrine. Okay, so those are the three prototypes that you will need to know for that particular class.